and we have like 15 counties without a doctor. This is Texas, the largest state. So they could benefit from a program like the one in Mexico. The experiences following my education. Well, following my education, I became so interested in research and education. I continued to do research at the University of Pennsylvania, and so at that time you only had what you call a student's visa, and you had to get out. They extended mine more than the average because I was able to take my years of residency, a total of 5 or 6 years in the States, having a student's visa, and then they said you have to go back to your country. That was the arrangement they had. So I went back to Mexico. Fortunately, when I began in Mexico City, at that time the president of Mexico was asking for Mexican doctors doing research who wanted to come back, and they installed me with very nice laboratories. I had 2 or 3 doctors working for me in research, full-time research in psychoactive drugs, marijuana, LSD, amphetamines, the drugs of addiction, and we have a wonderful lab. However, in Mexico, and I think this is still truth, every 6 years things change completely. So when the next president was elected and he saw the budget that we had for research in psychopharmacology, he decided this is not for us. We don't need people like Carranza or other of my colleagues. So I had to do something. I had to get out of Mexico, and I had been collaborating with many American researchers. One of my best friends is Professor John Overall, who was at that time at UTMB in Galveston. And I have another friend, Dr. Carlton Turner from the University of Mississippi, who was working at the White House. So they easily helped me to get very special visas for me and my family. My wife and 4 children who were little, and that's how we came to work here. So the adversities started with me when I came here. my first assignment in Philadelphia, when I came to work in Philadelphia, I remember most of the patients in the downtown medical school were African Americans, and for a Mexican who couldn't speak a little English, I couldn't understand one word of what they were saying. So one of my African American doctor's friends noticed that, and she said to me, "Listen, after you talk to the patient, come to me and I'll tell you what he's telling you." So that was a little difficult for me to understand as Mr. Pucci said, this conglomeration of so many cultures and so many accents, and they have their own gibberish. So what I did, I found a high school in Philadelphia that had a course for foreigners. So I started going every night to take English lessons in that high school. To my surprise, this town in Philadelphia, there was an area that is called Little Italy. That's where Mario Lanza was born, where no one spoke English. They all spoke Italian. It's very interesting. I mean, if you go to Philadelphia one day, I mean, you will be amazed. They had an Italian market. I mean, they had, and all of the students in the high school that I was going to, I was the only Mexican. Everyone was Italian who wanted to learn some English. They were born there, 2nd or 3rd generation of Italians. They only spoke Italian. So I felt better. So I mean, I kept, and particularly in psychiatry, you need to really know the language. I mean, in some other specialties, in surgery, sometimes you don't have to talk too much, okay? You have to do a lot of manual work, but in psychiatry, you have to communicate. So I learned English perfectly. And also, when I went to France, the first 3 months that I couldn't understand French perfectly, my professor there said, well, the first 3 months you are going to see only Latin American and American patients in Paris. So I saw all of the Americans who got psychotic in Paris, or all of the Latin Americans who got psychotic. So I saw after 3 months that I was able to really speak the French and understand French, then I was able to continue in French. You tell me how long.
Could you give us 10 or 15 minutes
of the drug?
With the
all right.
drug,
Okay.
the dangers
One of the things I discussed with Joe was if maybe we should do 2 conferences, and he said yes, because the amount of information that I have about drugs is wide. However, I will begin today to tell you that medicine and psychiatry particularly, we have an epidemic, and that's the drug epidemic. And it's devastating, okay? For many years, Americans were the country that smoked more marijuana than anyone in the world. And the rumor was spread that marijuana is okay, marijuana is blah, 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 okay? Even the English, I remember going to a conference of marijuana in Oxford, and the English were even more liberal. They always allowed all of their young people to smoke hashish and marijuana, and they told us, you Americans are very paternalistic. I mean, they should do whatever they want with their brains. Now, I just brought it because today I continually receive emails from colleagues in England. There is a publication in the British Journal of Psychiatry that was just, I mean, this is the latest publication, and it's a prospective study of 6,000 people, okay? They prove that the people who smoke marijuana early in life had more psychosis even in later life. That schizophrenia is more common in the people who were in the marijuana smoking group. This is happening today. The English are in a biggest problem than we are, because they were so liberal about it. Okay, so in this country we have had these people, particularly in California and Nevada, and well, Nevada always goes after what Californians do, okay? So Nevada and New Mexico, they go, they just listen to what Californians, and Californians began a so-called local medical marijuana, in which it's only an excuse of the pro-marijuana people to increase the number of people smoking marijuana. Marijuana is not a medicine, but it has been the worst excuse, and then there is more people addicted to marijuana. It's calculated that 45 million Americans smoke marijuana. This is devastating. I mean, and you still have many people